Welcome to CareTalk, America's home for incisive debate about healthcare, business, and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, it's summertime. Is it time to kick back without care? There can't be any healthcare issues that are still hanging out as the weather starts to get warm and people start to jump in the pools and start to relax a little bit.
John, we may be living on a different planet because where I am, it's the third COVID summer in a row. And I think, things are different this year, but there's enough worrying signs and
Oh,
unknowns that
David, masks are off. Windows are open. Lions are lying down with lambs. COVID? What's COVID?
I agree, John. And I'll just have to ask, this will be a rhetorical question, John, but how many waves of COVID are there now anyway? I understand it's about a sixth wave. So, John, here I think you're starting to already give away the answer to the question. I mean, are you ready for a relaxing vacation? Or will there still be a pandemic this summer?
Well, I think that the reality is, yes, everybody should be ready and prepared to relax in the summer, but COVID's very much still with us. And it's still very much a pandemic. It's not endemic. It's still morphing in different forms. The COVID, a new, I think it's BA4 or 5, is running right through England right now, and U.S. is usually about 3 to 4 months behind England. So we may be in wave 6, but I think you're going to see wave 7 hit in the fall. And look, this is still a very highly contagious disease. 7 to 20% of people have long-term symptoms. We've got to use the tools we've got and still be sensible about the fact that it isn't over, no matter what, David, you and your conservative allies think.
Well, so John, the summer's the time I like to go and hear some concerts, as do others. And at every end of the spectrum, there's some challenges. So Ringo Starr, who you may remember from your day back when you were a teenager, was going on tour, and that's postponed until September because everybody in the band got COVID. And meanwhile, Tanglewood, which is probably a little too refined for your tastes, they have advisories on masks. They've also improved their ventilation. So you're not going to get away from it. But basically, we're being told in terms of the restrictions, you decide on your own what's necessary. That's the new mantra.
Well, I think socially, look, every pandemic historically has had the pandemic, even the terrible pandemic of 1918, which killed 20 million to 40 million people. It's really hard to tell because it was also during the middle of a world war, and there were plenty of other infectious diseases. The pandemic lasted long after people stopped worrying about it. There were waves after it was supposed to be ended. So it is a natural human tendency to want to avoid adapting to the new abnormal. But I think it's really dangerous, David. I mean, the reason why Ringo Starr and people who are as old as you are canceling concerts is because COVID remains quite dangerous for people over the age of 75, over the age of 65. There is enormous protection against serious hospitalization and death if you're immunized and boosted. But look, 1 out of every 17 person who has no symptoms today, wandering around near the red line on the mass transit near you, will be positive COVID and won't even realize it. That non-symptomatic COVID is still a thing. It's still ripping through society, and long COVID's really a problem. So I think even though their instinct is to drop their guard, I think it's crazy that you're probably one of those people who don't think that the airline should be testing people before they do international travel. But I think we are dropping the guard while the enemy is still at the gate.
Well, John, I am taking an international trip this week. I'm slated to do it anyway. And, what are the current travel restrictions anyway?
Oh, as far as I can tell, there aren't. The travel industry says it's a great time to give them money and travel. And look, it is a great time to travel, and airlines are relatively safe. Airports probably a little less so. But the notion that we should be dropping testing requirements and dropping masking environments while this COVID is on the rise. I mean, just in the state of Colorado, COVID infections are up 50%. Hospitalizations are up 40%. Like a couple of months ago in my home state of Colorado, COVID was ripping through at about a 50% increase in month over month. Hospitalizations were up, deaths were up. I mean, I think we're going to see a series of waves, and in that context, yeah, live your life, but do the basics, like test people coming from abroad, and mask when you're in around a lot of people you don't know.
Well, John, all I can say is you're such a pessimistic guy and so negative. I'm glad that you're wearing your mask most of the time so we don't have to hear all the negativity. The U.S. is.
I'm sitting here in my room in a very safe, well-ventilated environment. But David, you're going to just ignore this and fly
No.
around without restriction?
No, I wear a mask when I travel, John. And I note the U.S. is ending the requirements for the negative COVID test for the international arrivals. And I think, on the
That's
one hand,
nuts. Crazy
well,
town.
it may be, but I think what's going to happen is that in and of itself will probably drive cases up because sick people, we're traveling will infect others on the flight. People are probably being less careful in the past because before, when you were abroad, you figured, hey, I got to pass my test before I go home, so I'm going to be careful. And then there's no mask requirement. So I think bringing all those three things together is a little bit scary. Now, let's point out that some of these restrictions made a lot of.
Let's unpack that, David. So
Yeah.
we've already established that Omicron grows faster in other geographies than our own, that whatever hits England and parts of Europe is going to hit us 3 or 4 months later. So we know that even if COVID was dropping like a rock here, it's likely to be rising somewhere else, like South Africa or Portugal. Why would you drop testing requirements in that context? It just doesn't make any sense.
So the number of people coming in as a proportion of the overall population isn't that high. So only when the differences are very stark. So, for example, in Israel, they shut the borders when Omicron started because it gave them a chance to roll out the booster for a lot of people. And then, but they know, hey, it's going to come here anyway. So they reduce those restrictions later on. Even a geographically isolated place like Australia or New Zealand, it could make sense. But while it's dramatic for any given flight, maybe bringing 100 people in that have COVID, overall, it doesn't make that much of a difference. It's a big pain in the neck. John, I want to live my life. I want to see the sights.
Well, I hope you're vaccinating the kids, because at least we now know that we can vaccinate children, and that's a big change between the first couple of COVID summers and COVID summer number 3. I hope you're vaccinating your whole family.
Well, John, the kids, both my kids that I acknowledge and those that I don't, that may be the age that you're talking about, they're now able to get the vaccine. So that I think that's helpful. But John, you talked about these demics before: pandemic, endemic. Whatever happened to herd immunity? That's what I thought we were going to be getting.
Oh, good luck with that. I mean, I think one of the challenges with this disease is the more we know, the more the way we look at the world changes based on new science and new perspectives. I don't think we're close to a level of herd immunity. What we are close to in vaccinated populations is, either active T cell or B cell, effective immune walls or barriers that won't keep you from breakthrough infections completely, but they do protect you from, as far as the variants we know of, against serious illness and death. And David, there's even more interesting vaccine technology coming. That is those that are delivered through nasal mist that look to potentially, with correctly designed, give us even more of a fighting chance to kind of contain and limit the impact of this terrible virus. But I really want to underscore the fact, and we touched on it before, that long COVID is a real thing, and some of whether it's brain fog or cardiac problems or potential brain problems or just basic inflammation, aches and pains. That this is something to be careful about, particularly as new variants are emerging. And I don't think we should be dropping our guard, but I think we also all have to acknowledge that everybody's going to live their life, but you can live your life with modest modifications.
Well, John,
and still be safe.
Well, John, the good news is, okay, so I don't have to wear my mask. I'm not going to have to be tested when I come back. Vaccinations are working, so I like that. So certainly, I'm sure what we're doing, John, is making sure that, all the people in the U.S. that wanted to get vaccinated have done so. And I'm sure we're making that possible for all the people in other parts of the world, especially the poorer nations.
I think we have an issue there. Because the only way they're going to get vaccinations is if we pay for them. And I think that the industrialized world has not shown a willingness to invest in getting the rest of the world vaccinated. Now, look, that's a big task, and it's going to be harder in certain areas than others. But the more people who are vaccinated and boosted, the less hosts this virus has to morph, grow, and change in more dangerous ways. So I think that's a big miss. But I mean, it's not just the rest of the world. I mean, Congress has pulled back funds for basic testing and a lot of the areas of testing and healthcare access and support that it injected into the system to get everybody vaccinated. So I again, not only has the general population backed off of worrying about COVID, it would appear, based on the dropping of masks and how people are socializing, but the feds have also kind of dropped the ball. And it's unfortunate. I mean, President Biden actually, I think, did a pretty good job getting the vaccine out, getting people vaccinated, and supporting the distribution of therapeutics. You know, he gets in trouble for a lot of things, but he kind of, with that plus the stimulus, kind of broke the back of this virus's impact on the country.
So that should mean that the Democrats, pick up increasing majorities in the midterms, and Biden's on his way for a re-election. Is that right?
David, I don't think so. Well, I think, first of all, that the incumbent party typically loses seats in the midterms, and it looks like the Democrats are going to overachieve on that one. But I think that's less to do with Biden, although I'm sure there are some things that you could point out there, but more the fact that I think people are just sick and tired of being sick and tired of this virus. And I think that there's the pandemic fatigue, in a sense that the world's a little bit out of control. Inflation doesn't help that. But I do have some sympathy for Joe Biden, who walked into a situation before the vaccines were distributed and people were vaccinated. And it's pretty massive to vaccinate a country as large as ours, to get the public health information out there, to make the therapeutics available, and to make sure businesses didn't collapse when we were in the midst of a raging pandemic. I think that President Trump deserves some credit for getting the whole, Operation Warp Speed started. But I think Biden is not getting any credit. No, I think quite the opposite. I think the Democrats are going to be bruised this fall, but I don't think that's really news.
All right, John. Well, from inflammation to inflation, we've been talking today about the COVID summer, the third one in a row, today on CareTalk. That's it for yet another episode of CareTalk. And I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you liked what you heard or you didn't, please subscribe on your favorite service.